Welcome to Aging on the Suncoast. I'm your host, Jason Martino. Did you know that Alzheimer's disease is the 6th largest cause of death for Americans? Did you also know that 33% of Americans will die with Alzheimer's disease or another type of dementia disorder? These facts are startling. Today's show is near and dear to me, not just because our agency provides services to families where an individual suffers from Alzheimer's disease or a related disorder, but also because I have personally seen close family members deal with the complexities of this disease. I'm devoting this show to my grandmother, who has recently passed away at the age of 95, and fortunately never suffered from Alzheimer's disease. Unfortunately, though, she had a daughter who lives with it currently, a reality my grandmother had a hard time grasping. On today's show, I've invited Amanda Brady-Wood, a program specialist with the Alzheimer's Association, the Florida Gulf Coast chapter. We're going to talk about this disease with the goal to increase your understanding and also learn where to turn for help. Amanda, we haven't covered this topic for, I think, about 5 years, and that is embarrassing to me. So I'm really glad that we have an opportunity to bring you on the show and talk about Alzheimer's disease and other related types of disorders, and especially your organization. So welcome to Aging on the Suncoast.
Thank you very much for having me.
No problem. Let's talk about it a little bit more broadly. Can you give our audience just a little bit of an understanding of what Alzheimer's disease is?
Absolutely. Alzheimer's disease is a progressive degenerative disease of the brain. It's not a typical part of aging, but it affects America greatly.
Yes, it sure does. It's a high prevalence from what I understand out there. Alzheimer's disease is sometimes associated with other dementia types of disorders, and I know that there's an abundance of them out there, and all of them have their little intricacies that make them individual. How do we differentiate Alzheimer's disease to other types of dementia disorders?
Well, that's a question I get asked a lot, that people sometimes are diagnosed with dementia, but then we want to look at dementia like a symptom, which is the cognitive impairment severe enough to affect our daily life that could be caused by one of 100 different types of dementia, but the most common form of dementia is Alzheimer's disease, affecting about 70% of all people with dementia.
70%, huh? Mm-hmm. That's such a great number. Wow.
It is.
Scary. So let's go through the process. And let's just assume that I have a loved one, let's say my spouse or maybe my father, that has been exhibiting different types of memory lapses for a couple months or maybe even a year. What type of conversation do I have with him or her? How do I approach that conversation with them?
That conversation is the most important piece, and it can be uncomfortable to have that conversation, but to bring up that we are concerned about them and we want to get it looked into. We don't recommend using the word Alzheimer's disease just because someone is having problems with their memory, because that can be intimidating, but no matter what's causing the memory loss, we can't treat it until it's diagnosed. So to let them know that we're concerned about them and encourage them to see a doctor to figure out what's going on.
Well, that sounds like maybe the next step that we would go into. There's lots of different types of doctors out there. So let's just go back to assuming again. I've had this conversation now with my wife or with my father or a loved one, and I approached it just as delicately as you did on there, and there was an agreement that there needed to be some follow-up to really ascertain really what was happening on there. So what kind of follow-up, what kind of medical physician do I go to see if they could diagnose it in an appropriate way?
We would recommend going to see a neurologist, since they have studied the brain for so many years and that is their expertise. They will be able to diagnose now if it is in fact Alzheimer's disease or if it's something else causing the memory loss. Mm-hmm. So we recommend seeing a neurologist.
Okay, good point. Do you have any experience? Can you walk us through the steps of what they could expect when they go to make that appointment with a neurologist?
Neurologists will do a whole body of tests, from blood work to CAT scans, a mental status exam to see if the person that's experiencing the memory loss is having maybe suffering from depression or stress, which can affect our memory. Mm-hmm. They will test our balance and our coordination to see if it maybe is something other than Alzheimer's disease. But they'll do a whole complete battery, a whole workup with blood work and many different tests and narrow down from there what's causing the problem.
It sounds like it really needs to be comprehensive if they're going to appropriately deduce what's going on with that individual.
Absolutely. There's not one single test yet that can diagnose Alzheimer's disease, but with this battery of tests, they can get conclusive diagnosis.
Okay, good deal. We were talking a little bit earlier prior to the show about the difficulties that multiple medications cause as well. And so hopefully they would be able to rule out any kind of masking of dementia types of disorder symptoms through taking a look at that person's medications too.
Yes.
Yeah. So, all right. So let's say that my family and I was a part of that process, because that's probably pretty important that a loved one go with that person that is alleged to have symptoms of Alzheimer's disease or another disorder. Let's say that the process was complete by the neurologist, and the neurologist made a decision, a positive affirmation that Alzheimer's disease was present. So for that family, that's going to be quite a transition. What's the major thing they should be thinking about when that family learns that it is true, in fact, that their loved one now has Alzheimer's disease?
Having that support from a family member or friend is really important. And from there, we can start building a care team, that we like to call it. So this will be our doctors that we can work with, our family, our friends, the community services like the Alzheimer's Association or the Area Agency on Aging, community services that can work together. Mm-hmm. And from there, with this care team, we can start planning for the future, for make financial decisions, getting a power of attorney, for example, in place, and making all those decisions now while we are still able to make those decisions for ourselves.
Yeah, planning is probably going to be pretty darn essential, because from my understanding, the next course of that person's life is going to transition in a way that they possibly didn't ever expect before. Healthcare surrogacy, that type of paperwork, that advance directive that seems to come up in our lives every once in a while, does that seem like an appropriate way to look at it too?
Absolutely. Getting a power of attorney, healthcare surrogacy, somebody that can make decisions on our behalf when we no longer can, that's somebody that we trust. And now we won't have any problems with a crisis later down the line when maybe if I couldn't make a decision on my behalf anymore and I haven't named someone to, that can cause a lot of problems.
Yeah, right. In our world, in the aging world, we know that people don't start to investigate different types of services that are available to them, or long-term care planning, unfortunately, until they get into a crisis situation. It sounds to me that if the neurologist was able to positively diagnose that person with Alzheimer's disease or another type of disorders, that would kickstart that process of them looking into different things. One of the other pieces of aging that we try to promote is taking a look at residency and the long-term care planning that they have on there, and then certainly caregiving is going to be a pretty big piece of that. Is that do we capture everything that we need to look at during that time?
Absolutely,
yeah.
I think so.
Okay. Now you have a pretty big jurisdiction of counties in the state of Florida that you serve, and I remember us talking a little bit before that you told me a very wild number about the prevalence of Alzheimer's disease within that catchment area. Can you just tell our audience what it looks like in your area?
Yes. The Alzheimer's Association Florida Gulf Coast chapter has about 9% of all Alzheimer's disease cases in the U.S. in our territory.
That is amazing.
There's, I believe, only 8 U.S. states with a bigger prevalence than here.
Yeah. So that's just the chapter. That's not the entire state. That's how many counties?
17 counties, from Citrus to Collier.
So that just amazes me, that the fact that you have 9% of the total prevalence of Alzheimer's disease within our nation. What about Pinellas and Pasco? That's our planning and service area for the Area Agency on Aging. What's the numbers look like for folks with Alzheimer's disease or related disorders?
In Pasco County, as of 2015, there was roughly 1 in every 35 people of all ages. And in Pinellas County, it was roughly every 1 in 30 of all ages.
Jeez, that's quite a lot.
It is.
Yeah.
It really is.
And as a planner for our agency, I feel like I should know that. But every time I hear that number, it startles me, just like I said in the intro for this show too. So with Alzheimer's disease, what can we do about it? If we know our family member has it, we've already talked about getting it appropriately diagnosed. That's very important, and not making assumptions. It's also, we talked about the planning aspect of that too. So the disease itself, is it curable?
Unfortunately, the disease is not curable at this time. There are medications on the market that can help with symptoms and help with quality of life for the person with the disease. At this time, these medications will not slow the progression of the disease. So while the progression of the person taking the medication might now have better short-term memory and better word recall, but the plaques and tangles that make up this disease and what impact the brain are still developing.
Yeah. Myths are big with aging. Any myths that you want to clear up out there so our audience knows a little bit more?
Oh, absolutely. I hear a lot that, well, dementia is a normal part of aging, and it really isn't. There's something to be said about as we get older, it might take us a minute longer to stand up, and it might take us a minute longer to remember somebody's name, or we might forget an appointment now again. But that's very different from the dementia associated with Alzheimer's disease, because that isn't normal.
Yeah.
I also hear that, if somebody has memory loss, it must be Alzheimer's disease, but it could be, as you mentioned earlier, medication interaction.
Yeah.
Could be stress, depression, diabetes. There are many things that could cause someone to experience memory loss.
Well, thank you for clearing that up, because I hear it a lot, and I think I spend a good amount of energy trying to say the same thing to other people. Let's move forward a little bit. Tell us a little bit about the Alzheimer's Association.
At the Alzheimer's Association, we are the largest not-for-profit agency in advancing Alzheimer's disease research, advocacy, and support in the nation. That's
fantastic. We're glad you're in the state of Florida. Are you in your national and in the state, and you have chapters, correct? Like the Florida Gulf Coast chapter?
Yes, there's chapters that cover different territory, but we work together as one unit to cover the nation.
Oh, that's awesome. And so who are your services really geared to?
Our services are geared towards people with Alzheimer's disease or related dementias. It doesn't have to be necessarily Alzheimer's disease. So those that have been diagnosed or are concerned can call us, as well as their family members, their friends, caregivers. We try to offer a lot of support for them, as the person with the disease is going to need help, and that's when their caregivers come into place.
Yeah.
As well as professionals in the community. We're there for them too.
Yeah, we, as an area agency on aging, we serve a bounty of caregivers, and I always refer to them as the battery pack of that family dynamic, because unfortunately without them, sometimes that family is going to fall apart. They are the energy that's there. Do your services, are they free, or how do people pay for this?
We never charge the community. The Alzheimer's Association, we do have something called a medic alert and safe return program, which can help prevent wandering. It's a bracelet that somebody can wear, and that does have a fee, but any of the other services we offer, we don't charge. Yeah,
that's really awesome. And obviously, you can't do it alone. I think we've made a lot of referrals to your organization to serve the folks mutually on there too.
Oh, yes. We refer to the Area Agency on Aging, as well as other agencies in the community, doctors, and other referrals. Because like you said, nobody can do it alone.
Yeah. Amanda, we're so happy that you're on the show, and you're going to stick with us for the second half of the show. Please stay with us while we take a short break. As usual, don't forget to have a pen or pencil ready. During the break and at the end of our show, we'll be running contact information for the Aging and Disability Resource Center helpline, as well as the Alzheimer's Association.
Elder abuse is always devastating, but it may not always be obvious. Isolation, coercion, and the withholding of medication are only a few of the more subtle forms of elder abuse that occur every day to thousands of our senior citizens. Please join me in the fight to end elder abuse. Our elders deserve better. Visit the website of the National Center on Elder Abuse. It's time to speak up. Hi, I'm William Mapother. I play Ethan Rhyme on the TV show Lost. Let me tell you about a truly lost population. Every single day, thousands of our elderly citizens are subjected to abuse. Emotional, financial, physical. Worse, the majority of people who commit these acts are those closest to the victim. Please join me in the fight to end elder abuse. It's time to speak up. Our elders deserve better.
Welcome back to Aging on the Suncoast. During the first half of the show, Amanda Brady-Wood helped us understand a little about Alzheimer's disease and about the Alzheimer's Association. So let's move this conversation forward and delve into some resources the Alzheimer's Association offers in our community. Amanda, welcome back to the show. I enjoyed the first segment. We accomplished a lot of different things. We were able to talk about Alzheimer's disease, and we were able to talk very broadly about your organization and a little bit about what you can do. But let's go a little further and talk about some of the neat things that you provide in the community. And I know that you have a 17-county catchment area, but that also affects Pinellas and Pasco County. So a little bit before, you were talking about a 1-800 number that you guys sponsor. Can you talk a little bit about that 1-800 number?
Yes, that number is our 24/7 helpline. So anyone from nationwide can call this helpline 365 days a year. This way, somebody can speak to someone any time. They won't get a voicemail, and they'll have somebody that they can talk to through if they're having a crisis, they have a question, or they just need some information.
Yeah. And many times when people call our helplines, and we both operate these helplines over here, they are in a crisis situation. A lot of times and we have trained individuals. Obviously, you have trained individuals that know how to de-escalate people's emotions and whatnot.
Yes, we have master's levels clinicians that can speak with people and offer them the support and advice that they need. Yeah,
what a great resource you have. And anywhere around the nation, somebody can call that number and have a live voice-to-voice contact with them.
Absolutely.
You may not know this, but I'll just ask anyway. And a lot of times, and the reason I ask this is because the dynamics of families is so different in Florida because we're a transient state. A lot of people come from different states. So if mom lived in Pinellas County, and let's say her daughter lived in New Jersey, and she had questions about her mother, and she called the Alzheimer's Association from New Jersey, they would be able to patch through that information that's appropriate for the area that she's in?
Yes, they would, and they can also connect her to the local chapter in wherever area she needs. So if she needs to talk to the Florida Gulf Coast chapter for services near her, or she can talk to a chapter in New Jersey that can help her with services that are up there as well.
What a great resource that you have there. And that's a national one, and then also, like you said, it can trickle down to the local level.
Yes.
What do you offer in the community? A lot of times as an area agency on aging, we're doing outreach or we're doing some community presentations, this and that. What do you do in the community?
One of the things we offer are our education programs and caregiver trainings. So the education programs are they're always open to the community and will cover the basics of Alzheimer's disease or the 10 warning signs, for example. Then we have what we like to call caregiver trainings. So these education programs can focus on managing challenging behaviors to effective communication strategies. Yeah. We also have some called Living with Alzheimer's Disease, and these can be a series of programs geared either towards the caregiver or towards the person with the disease.
Yeah, it sounds like all the topics that we talked about and you just mentioned again are topics to help mitigate caregiver burnout, which we see a lot in there.
Yes.
And that was always been the aim for the area agency on aging, is to try to assist the caregiver as much as possible, because like we talked about a little bit before, my personal opinion is they are the battery pack of the dynamic, and to take care of that battery is going to be pretty darn essential. So you guys are doing more great things in the community, helping them understand and learning best practices. And I know you have another modality that's probably a little bit more personable, and that's the modality of support groups. Can you tell us about the support groups that you guys offer in Pinellas and Pasco County?
Yes, we have support groups for caregivers, and we even have support groups for people in the early stages of Alzheimer's disease.
Yeah.
So they can come with their loved ones and be with other people who can understand and relate for a period of time.
Yeah. Equal support groups and the topics that they, or the amount in Pasco and Pinellas County?
Right now we do have more support groups in Pinellas. People from Pasco are welcome to come, but we do have some in Pasco as well.
Okay. Okay. The 1-800, I'm going to go back to that because that's a foundation for people in the community, near or far, to understand what services that we have out there and where they're at. If I were to call that 1-800 number and I was interested in when your next community public education process, I would be able to find out that information through that number?
Absolutely. It can also be found online at our website, which is alz.org.
Okay.
But absolutely, calling either that number or going online, all that information is readily available.
Yeah, and the same thing for support groups. I can call that number and find out where they're at?
Correct.
Okay, because we're going to run graphics a little bit throughout the show, actually, and that's going to that number is going to be really important for people to understand. A little bit more about support groups, and we'll move on. Walk us through how they would operate and the benefits somebody would receive by being a part of a support group.
Our support groups are usually very casual. People become a cohesive group, getting to bounce ideas off each other and having someone that can say, I know what you're going through. Giving maybe tips and tricks that they've used that have worked with their loved ones. Some of these, we have mentioned caregiver burnout. These support groups can be really helpful for caregivers to let off some steam and talk about the frustrations of being a full-time caregiver. And some of our support groups also offer respite care. So if you don't feel comfortable leaving your loved one with dementia at home, you can bring them with you and they'll be cared for while you're at your support group.
Yeah. One of the things that I think about too, correct me if I'm wrong, is that there's leadership probably organically develops during these support groups as well. Let's say that somebody is a longtime support group member and there's ebbs and flows to the participation in it. A lot of times there is a certain leadership that person feels, and they could help facilitate those groups and guide newcomers to that, which is pretty darn important because support groups, in my opinion, are a time for sharing and also for receiving feedback. And feedback, hopefully, is always going to be constructive and also maybe offer best practices and whatnot, too.
Absolutely.
Yeah. Do you know about how many you offer throughout both Pasco and Pinellas County?
I say we have over 20 to 25, I believe, between the two counties.
That's amazing. I did not know that much. Good for you guys. And obviously, someone will understand where they're at by calling that number on there.
Yes.
In another part of the aging world, we use the term, and I'm not going to speak in acronyms today, we use the term case management, and that means something to us and to the people that provide it. When you and I were talking a little bit earlier, you had mentioned the term care consultation. Can you tell us what care consultation is?
Yes, we also offer care consultations to the community where we can meet with a family or either at our office, or we can even go to their home and let them explain to us what exactly is going on, and we'll from there pull together as many resources as we can to help them along the way. As we talked about, nobody can do this alone, so we'll collect. There's resources from elder law attorneys to neurologists to other referrals in the community that can be helpful to them. Yeah,
and I think you make a great point about having the capability of going to that person's home. There's so many people that are homebound,
yes.
And it would be unsafe if they were to leave their loved one there by themselves while they went to your office or this and that. You offering that opportunity is amazing, and I think that it gives that person a sense of freedom when they can come and visit and actually have somebody else visualize what's going on in their life. And it probably makes a great deal of sense, too, that when you're doing some sort of an assessment as a care consultation, that I'll just say it like this. Sometimes people call our helpline and they paint a lot rosier picture over the telephone than when you actually get into that person's home and you're able to assess their environment and actually compare what they said over the phone versus that. You see some differences on there. I imagine that's the same for you.
Yes, I've experienced that where when you see it, it's the stages, the person might be in a later stage or the situation is not as rosy as they had said.
So all the more better to get a hold of your organization to have a care consultation occur so they can figure out appropriately and adequately what's necessary to do the job. Let's go back to care team. Care team was sounded like a pretty big function. It also sounded like a familial function as well as an organizational function. Can you elaborate a little bit on that?
Yes, I really like the word care team. We mentioned can't do this alone. The caregiver can't do that alone, or the person that was diagnosed. So to have this team of people that care, and we'll have, like I mentioned earlier, maybe possibly elder law attorneys or care managers, doctors, the nurses that we're going to be working with, as well as family, friends, the people in your support group. This is going to build the team and make it bigger and bigger.
Yeah, and I think you make a great point. It's how they say the saying is it takes a community to raise a child. It takes a community to raise anybody, really, in my opinion. Not raise them, but to care for, in some sense of like that too. Our agency utilizes volunteers as well as some of the organizations that we contract with to provide neat home and community-based services out there. And volunteers are such an integral part of any not-for-profit, and I learned today that you guys are the largest not-for-profit dealing with Alzheimer's disease and related disorders. Do you have opportunities for volunteers to come to your organization and provide their skill sets?
We do, and we love and appreciate our volunteers. They're wonderful people. From either some help in the office, or we recently had this in the fall. We had our Walk to End Alzheimer's, which are huge, and they're wonderful fundraisers, and as well as support group facilitators, as we talked about support groups. All of our fantastic support groups are run by wonderful volunteers who facilitate them.
What an asset you got. I'm glad that you're able to have those people that care so much to do that. Amanda, I appreciate so much for you coming on the show. And like I said before, it's a topic that we haven't covered in a little while. That's embarrassing to me, and we're going to make sure that this is an annual thing. But I appreciate you coming on our show today.
Thank you so much for having me.
No problem. We hope you enjoyed this month's broadcast. We also hope this episode encouraged you to seek assistance through the Alzheimer's Association or our helpline. Together, we as partner agencies hope to make your journey an easier navigational opportunity. We'll see you next month. Until then, seize every opportunity in the new year.
Elder abuse is always devastating, but it may not always be obvious. Isolation, coercion, and the withholding of medication are only a few of the more subtle forms of elder abuse that occur every day to thousands of our senior citizens. Please join me in the fight to end elder abuse. Our elders deserve better. Visit the website of the National Center on Elder Abuse. It's time to speak up. Hi, I'm William Maypother. I play Ethan Rahm on the TV show Lost. Let me tell you about a truly lost population. Every single day, thousands of our elderly citizens are subjected to abuse. Emotional, financial, physical. Worse, the majority of people who commit these acts are those closest to the victim. Please join me in the fight to end elder abuse. It's time to speak up. Our elders deserve better.